Good morning, everyone, and you're very welcome to the Institute of Public Health webinar today. My name is Suzanne Costello. It's really super to see the level of interest in today's event, and that's not least to do with the excellent contributors gathered here today. And I'd really like to thank my colleagues, Professor Roger Sullivan and Dr. Annette Burns, for their work in organising this webinar, and to all of you for taking the time to attend. The significance of this issue is recognised amongst policymakers north and south, and with that in mind, we're really pleased to welcome input from Mary Butler, TD, Minister of State with responsibility for mental health in older people in the Republic of Ireland, and from Professor Siobhan O'Neill, Mental Health Champion for Northern Ireland. Siobhan couldn't be here today in person, but has very kindly recorded a contribution. I hope you find the discussion today useful in your own work, and with that in mind, I'd like to ask Minister Butler to open proceedings today. Over to you, Minister.
Good morning, everybody, and I am delighted to be here at today's seminar, kindly hosted and organised by the Institute of Public Health. I would like to thank Suzanne and the rest of the team at the Institute of Public Health for hosting this event and for the kind invitation to give an opening address, which is both a privilege and an honour. The theme of this morning's seminar is Rethinking Loneliness and Social Isolation post-COVID-19. I would like to commend the Institute of Public Health for organising this timely and topical event. I anticipate very interesting and informative discussions on the topic of loneliness and social isolation, especially given the high calibre of speakers and panellists participating this morning. While even in ordinary times, every one of us can experience loneliness and social isolation, no one can be in any doubt that the COVID-19 pandemic and the associated restrictions have challenged society greatly, especially in the area of human interaction and connectedness. As part of our response to these challenges, the Department of Health has provided guidance and support for people to manage both their physical and mental well-being and to stay connected. In November of last year, the Department of Health launched the Keep Well campaign, which sought to support our citizens through the difficult winter months ahead. Significant funds are being invested in this new initiative, with 7 million to support the delivery of a range of actions and support services, which will be rolled out over the coming months. The campaign will encourage us all to do something that is good for us each day of the week, like going for a walk, connecting safely with friends or family, engaging in a hobby, or reaching out for the supports that we may need. By doing so, we will create balance, routine, and resilience. The campaign is focused on 5 main themes, which include staying connected and minding your mood. As isolation of people of all ages is a significant risk during the COVID pandemic, particularly during continued periods of tight restrictions on movement and social interaction, the Staying Connected theme addresses isolation. It supports volunteerism, and where would we be without our volunteers, and initiatives that support person-to-person connection, which is important to our well-being. As part of this, the Community Call programme will be significantly expanded to be proactive in outreach to potentially isolated persons. Working with partner organisations including An Garda Síochána, NGOs and Volunteer Ireland, there will be a particular emphasis on identifying and supporting those most at risk of isolation. The Community Call provides local helplines through local authorities to deliver practical supports and befriending. Under the Minding Your Mood theme, people will be equipped with information on where to go if they need support. The HSE recently launched a series of Minding Your Wellbeing online videos, which provides an opportunity for people to learn more about key elements of mental wellbeing, such as mindfulness, gratitude, self-care, and resilience. Additionally, the Children and Young People Service Committee are rolling out supports for children, young people, and families. The clear message is that whatever people are going through in terms of reduced social contexts, loneliness or isolation, we should all stay as connected and as healthy as possible, helping to strengthen community and individual resilience, restoring hope that we can and we will recover and make it through this together. Additionally, although I acknowledge the challenges presented by current restrictions, including the announcement of extended restrictions on Tuesday evening by An Taoiseach, I want to highlight that public health measures do include a social bubble to support particular groups who are at risk of isolation. People in certain categories can form a support bubble with one other household. These include those living alone with children under the age of 18, people living alone, those sharing parenting or custody arrangements, and those who live alone and have a carer or different carers who support them. Though I want to stress that loneliness is not a mental health condition, I acknowledge that it can be associated with negative mental and physical health. In response to the pandemic, the HSE has developed psychosocial supports for the whole population, including a significantly increased level of online and virtual supports. Last month, the HSE published a psychosocial framework. The framework acknowledges the impact of the pandemic on mental health in all areas of society and identifies priority groups, including healthcare workers and people bereaved due to COVID. The framework provides a cohesive, coordinated, consistent and collaborative approach to the provision of mental health services and supports across 5 key levels from mental health promotion to specialist supports. Moreover, I would like to reassure you that all aspects of mental health services are being improved and developed through implementation of Sharing the Vision, the new National Mental Health Policy and the HSE National Service Plan for 2021. The National Implementation and Monitoring Committee has been established to oversee implementation of the recommendations of Sharing the Vision. The National Suicide Reduction Strategy Connecting for Life has been extended by 4 years to 2024 to enable its continued implementation. Today's webinar brings together key experts in the areas of loneliness and isolation and builds on the existing evidence to tackle this challenge during and beyond COVID-19. The government is acutely aware of the impact the pandemic has on all our lives, including individuals' experiences of loneliness and social isolation. And if I could just say one thing, there's a perception out there that social isolation happens predominantly in rural areas, but I'm of the opinion that you could be living in the busiest street in the middle of Dublin or in Cork or Galway or Waterford, wherever, the busiest town, and you could still be living in social isolation. So it's not an issue. You know, a lot of people would say that rural isolation would be predominant, but social isolation can occur anywhere. I would again like to take this opportunity to congratulate all those involved in today's event, both the team and Institute of Public Health and my fellow participants. I am confident that the work being presented upon today will continue to have a positive impact and will enhance the well-being and quality of life for many people. I certainly do believe there are brighter days ahead, and you know, I would like to wish everybody well. Take care, and best of luck again in this webinar today. Gorv Mahagat.
There's mounting evidence that loneliness is toxic. We are pack animals and we literally crave company. It's essential for our survival. Our bodies and brains require connections with others in order to be healthy. People who are lonely are 50% more likely to die prematurely than those with strong social connections. Loneliness is a significant cause of stress that costs us dearly. In these difficult times when we are required to stay apart in order to keep each other safe, it's doubly important that we work together to address loneliness. Loneliness and isolation knows no borders, and I'm delighted to open this webinar and pleased that it is a North-South All-Ireland event, building on our very long established relationships of cooperation and collaboration. As interim mental health champion for Northern Ireland, my role is to promote mental health and well-being across government departments. And loneliness is an example of something that does cross those departments. Health, the economy, infrastructure, agriculture, all have a role to play here. So I'm very grateful for the conversations that you will be having today. and look forward to hearing about the outcome of your deliberations to provide us with ideas about the way forward. I'm keen to know about your thoughts on the impact of loneliness and social isolation in the pandemic and the role of inequality, the age group differences, the impact on children, and the challenges and opportunities that the pandemic brings us. I'm genuinely sorry I can't be here today in person, but I'm keen to receive your suggestions on where we should go from here to address loneliness. And I assure you that I am fully committed to driving the policy changes that are required and supporting our executive in addressing this issue. Thank you.
Thank you, Minister, and thanks to Professor O'Neill. And now I'd like to hand over to our own Professor Roger Sullivan to start the day.
Hello, everybody. Again, you're very welcome. Thank you, Minister. Thank you, Professor O'Neill, and thank you, Siobhan. I'm delighted that the theme of this event has struck a chord with so many people. We have over 1,100 people have registered for today's event, and that's a sign of the importance of this theme and people's interest in it. We're going to now have a little bit of interaction. You've heard two presentations. So we're going to run a poll now. We're going to have two polls just straight after each other. So Adam, can you make the polls ready? So the first question is, have you or someone you know experienced loneliness during the pandemic? So very straightforward. You click yes or no. The host or the panelists, unfortunately, can't vote. So everyone, if you could now cast your votes. Okay. So, Adam, do you want to display the results? Okay. So you can see today, 96% of the 500 people, or sorry, the 460 people approximately that voted indicated that they knew someone who experienced loneliness during the pandemic. Okay, very, very striking. We'll go to our next question, which is, Adam, can you display the, yes, so who would you talk to if you felt lonely or isolated? Please tick all that apply. So would you contact a friend, a family member, a neighbor, a voluntary group or charity, a health professional? Would you talk to them, such as a GP, a member of the clergy, other, or you don't know? Please cast your votes now. Thank you. This will give us a really nice insight, and we'll use the three polls to help stimulate discussion during the panel section of the meeting. Okay. Adam, do you want to display votes? Okay. So you can see friends and family come out very top. Neighbor, less than 17%. A voluntary group, 10%. A health professional, 15%. Member of the clergy, 6%. Other, 9%, and don't know. So look, thank you very, very much. That's been really, really useful. As we work from home, we get to know a lot about using Zoom and the challenges and pitfalls. One of those that I experience is an internet connection that seems to have a mind of its own. And because of that, we thought it was better that I would do a pre-recorded presentation. So what's going to follow is a pre-recorded presentation. And I'm delighted to be able to use for the very first time that famous phrase. Here's one that I prepared earlier. So Adam, thank you very much. The aim of my presentation is to help set the context for the panel discussion. I will briefly touch on a range of issues in this presentation to support the panel discussion that will follow. I believe it is important to understand loneliness, to know how to address it, whether this is at a personal, community, structure, or policy level. The structure of my talk this morning will be in two parts. First, understanding loneliness, definitions, types, frequency, measurement, and health. The second part uses official data to understand social and demographic characteristics associated with loneliness in Northern Ireland and Ireland. Loneliness is a negative emotional feeling. It's the outcome of the difference between one's desired and achieved social relations. Loneliness is a subjective, unwelcomed feeling of the lack or loss of companionship or meaning in relationships, emotional or social. The key to understanding loneliness is the person's expectation. Is it a social connection to an intimate other, or family or friends, or is it connection with community life or broader society? One could be surrounded but still feel lonely. Loneliness is a subjective experience. It's a very personal experience. Two people may experience the same thing and have very different outcomes. It may be that a person has too few relationships, or is lacking the quality or closeness that they are seeking. Terminology matters. The terms loneliness and social isolation are often used interchangeably. However, they are quite distinct. As I've said, loneliness is a subjective feeling, whereas social isolation is objective. By that I mean social isolation is much easier to measure. Loneliness can be hidden. Can you tell if someone is lonely? Not everyone who is lonely is socially isolated, and not everyone who is socially isolated is lonely. Social isolation is about the number of relations, social interactions, social support structures, and engagement with wider communities or activities. It is measured in terms of the size and number in your network. In understanding social isolation, one looks at primary groups such as family and friends and neighbours, and secondary groups, clubs, churches, and work. So now we'll consider three different types of loneliness. Social loneliness is the absence of a connection with friends, neighbours, and colleagues. Emotional loneliness is the absence of a significant other with whom one has a close emotional attachment, say a partner or best friend. Existential loneliness is the sense of longing that cannot be achieved through any type of social interaction. Despite solid relationships, the person may still feel empty. I consider there are four frequencies of loneliness: transient, experienced at times of bereavement, retirement, moving, becoming a carer; situational, occurring at certain times of the year or occasions, for example, the pandemic; occasional, a feeling that comes and goes, often seen as a natural part of being human; chronic, here one feels lonely all or most of the time. Associations with loneliness and poor health or well-being have been established for over 30 years. Evidence suggests associations with depression and anxiety, non-communicable diseases such as cardiovascular disease, health behaviours such as smoking, stress, sleep, cognition, frailty, and premature mortality, with the evidence especially strong for depression. Paradoxically, there is a concern that chronic loneliness can adversely affect one's ability to connect positively with others and to engage in interactions that could decrease loneliness. A recent Lancet article underscores the association of loneliness and social isolation with poor physical health outcomes. It moves beyond the view that frailty is associated with loneliness and social isolation and argues that both loneliness and social isolation actually increase the risk of developing frailty. It is important to note when looking at the issue of loneliness and social isolation that definitions matter, but so too is recognising that different studies can use different scales or single item measures or specific questions. You may not be comparing like with like. Working with colleagues at a national and international level, we recently published a paper that called for consensus in the areas of definitions and measurement to help inform research, policy and practice in the area. In this next section, I will use data collected by both NISRA and the CSO before and during the pandemic. In April 2020, NISRA launched a COVID-19 opinion survey to measure how the pandemic was affecting people's lives and behaviours in Northern Ireland. In total, interviews have been carried out with 9,500 members of the public in the period April to January 2021. In Ireland, the CSO have undertaken a social impact of COVID-19 survey in the period April to November 2020 with some 5,100 respondents. Today, I'm not making direct comparisons between data from Ireland and Northern Ireland due to the different questions and methodology, survey response methods, age categories, sample sizes, and timelines. I have regrouped the responses from 5 options to 3 for presentation purposes to the question, how often do you feel lonely? Some 5% of people interviewed in the period April 2020 to January 2021 reported feeling lonely often or always. This is the same as the NISRA published figure for 2019-2020 and 2018-2019. There was a slight increase in those who reported being lonely some of the time and occasionally. On the next slides, we will see a further breakdown of this data. This is a busy but important slide. It compares loneliness in 2018 with 2020-21 data. What you see is that the level of often always lonely has remained similar for some age groups, 16 to 44 and 75 plus. In the age group 45 to 64, there is a slight decrease. However, note those aged 16 to 24 have seen the biggest increase in reporting being lonely, some of the time or occasionally. If we look now at those with a limiting long-term illness compared to those without, you will note that they are much more likely to report feeling often or always lonely, 12% versus 3%. In this slide, we see a gender difference with loneliness, especially in the some of the time occasionally category, being higher in women than in men in Northern Ireland, both pre and during the pandemic. The NISRA data indicates loneliness was found to be higher in urban areas than rural areas, both before and during the pandemic. Presently, 40% in urban areas compared to 33% in rural areas. The social gradient to loneliness is often forgotten in discussions, but from this data, it shows loneliness is relation and is much higher in the most deprived areas of Northern Ireland compared to the least deprived areas. Reporting often always feeling lonely is twice as likely in the most deprived areas compared to the least deprived areas, 8% compared to 4%. When we look at household type, single-person households have increased reporting always often lonely during the pandemic and are much more likely to report always often lonely compared to those who live with others. You will note the stark difference, 16% compared to 1% of those who are in one-person households compared to a 5-person household. If we now turn to Ireland, we will see a change of age groups time periods and question options in the presentation. I've regrouped here from 4 options to 3 for presentation purposes. The question asks, how often do you feel lonely in the last 4 weeks? Note a difference in the reporting of feeling lonely all or most of the time between 2018 to April 2020 and November 2020, and move from 4% to 7% to 14% in November 2020. In this slide, we compare loneliness by age group in 2018 and 2020 in Ireland. What we see is the level of loneliness for all or most of the time has increased for all age groups with the exception of those aged 70 plus. However, in particular, the age group 18 to 34 increased from 3% in 2018 to 26% in 2020, a move up to 1 in 4. The options of some of the time and a little of the time has risen for all groups, but notably the 18 to 34 have moved from 32 to 54%, and those aged 35 to 44 have moved from 31% to 62%. In this slide, we see a clear gender difference with loneliness higher for women than in men, both pre and during the pandemic. 53% for men versus 75% for women during 2020. In this slide, the CSO data shows that those in poor health are much more likely to report being lonely all or most of the time. Almost 1 in 3 report this compared to those in very good health. However, we've also seen an increase in those with very good health and good health in reporting being lonely in the last 4 weeks, some of the time or a little of the time. In terms of geography, feeling lonely is more pronounced in urban areas than rural areas. However, in 2020, we see an equal percentage in urban and rural areas who indicate they feel lonely in the last 4 weeks, some of the time or a little of the time, both at 51%. When we look at household type in Ireland, single-person households have increased reporting lonely all or most of the time, but notably all household types have had significant increases. In Northern Ireland, the overall loneliness levels are quite similar to pre-pandemic levels. However, data shows that particular groups experience higher levels of loneliness during this time. In Ireland, there has been a notable increase in loneliness compared to pre-pandemic levels. Data shows that particular groups have seen significant increases, including those not traditionally viewed as being at risk. Important factors include gender, being female, poor health, age, younger age groups, geography, urban over rural, deprivation, and household, living alone. I hope you found this presentation helpful, and if there are any questions after today's webinar, please feel free to email me. Thank you very much.
Hello everybody, and I hope you found that presentation helpful. We're going to have one more poll now. So the question, Adam, can you display it on the screen okay? The question is, do you think government should do more to address loneliness and social isolation during the pandemic? 3 options: yes, no, don't know. So if you could cast your votes now, please do so. I do feel a little bit like a game show host with these various options, but they are very useful to help stimulate discussion and reflection, and for the audience or the participants to actually get a feel of what other people are thinking and feeling. Okay, so Adam, do you want to now display? So we have a very strong message 85% of those people who cast their votes, and that's in the region of 450 people who voted, 85% said yes, 4% said no, and 11% said don't know. So again, this may help the panel to reflect on the 3 polls. So we're now moving to the panel stage of the discussion. So if the panelists could put on their cameras and mics, that'll be fantastic. Okay, and okay. So first of all, I want to thank the panel as a group for agreeing to take part. Everybody's very busy, but also being busy and then putting your name forward or agreeing to be part of a panel discussion for a set of questions. So thank you very much. So we've got, I can't tell what order people are on your screen, so I'll go, I'll start with, we've got Martin Rogan, who's the CEO of Mental Health Ireland. Martin, you're very welcome.
Nice, Roger.
We have Kula Yusuma, who is the Northern Ireland Commissioner for Children and Young People. You're very welcome. Thank you.
Thank you.
We have Denise Hayward from CEO of Volunteer Now. Denise and I know each other for about 20 years. We must have met at primary school, I think, Denise.
We definitely did, Roger. I'm not scotching that rumour.
And we've got Brian Lawler, Professor of Old Age Psychiatry and Psychiatrist at St James's Hospital in Dublin. Thank you. Okay, everybody, thank you very much. So we're coming up now to just 25 to 12. So we now have a chance to reflect on the polls, some of the data I presented, have a discussion. Don't worry, it's only the 5 of us here. We don't have to think about who else is there. But we're very lucky. We have a lot of people who are interested in this here, and that's because you're part of the panel and people want to hear what you think about these issues. So maybe we'll just start off. Have you any comments or thoughts or reflections on the poll or the data that has just been presented? Kula, can I ask you to start with, when you seen the poll or any of the data, any thoughts or reflections?
Well, I have, and I'll be honest, and I'm not sure I should be honest with so many people listening. I have been on a journey with regards to loneliness and how it affects children and young people, and I must admit that, and I know from some people listening were thinking, yeah, because you wouldn't have anything to do with us at the beginning of this. So I suppose I'm late to the loneliness conversation, particularly as it impacts children and young people. And so the data you presented, Roger, has been very interesting, but I recognise it talks about 16 and overs for the north of Ireland and 18 and overs for the Republic. But we have other data and information that reminds us this notion, that reminds us how lonely some young people are, even though no young person is alone. And what you said about, the graphic that you put up with the birds and the parrot in the middle, and that's young people, that's children and young people. They feel very lonely and isolated. So during the pandemic, a survey local to Northern Ireland of 11 to 21-year-olds found that 60% of young people expressed that isolation and loneliness was one of the main issues facing them during the pandemic. And then a Queen's report published in September of last year again highlights that actually it's young people who express feelings of loneliness more so than any other demographic. And so I've come to the party very, very late, but we can't ignore that sort of data about what our young people are telling us about how they feel and what it is that we need to do. And do we park this work in mental health, or do we park this work in play and leisure, or do we park this work in schools and education? or is it all of them? And obviously the answer is the latter. It's all of them. That it's one of the writing in the rock of all our work that we do with young people. It's one of the consistent questions we ask them. How do you feel? And then the other big elephant in the room is social media. Sorry, you didn't ask me to do a speech. I should have. But just very quickly, I'll say social media makes many of us feel very lonely, because we put the best of ourselves on social media. And when you're sat in your bedroom on your own and you see everyone else having a good time and you're not, that makes you feel, and that really impacts on young people's sense of self and well-being quite considerably. So I suppose, regrettably, nothing that I've heard surprised me, but it has reminded me of the job of work we have to do.
Okay, cool. Thank you. You've covered so much on that, so thank you so much. Really, really helpful. And Martin, do you, in terms of the poll or the data or anything that's been said so far, is there any reflections or comments? Before we get in, I should say we opened the panel discussion for people to submit questions in advance, and we have so many questions. We won't get through all of them, but there will be themes that we'll be able to cover. We'll try to cover as many as possible. But Martin, do you have any thoughts or reflections on what's been said in terms of the polls or the data or what's been said this morning so far?
I think what's really encouraging, I suppose, that we're having this event, because I think loneliness is probably one of these, almost the last stigma in terms of people acknowledging and recognizing the experience of loneliness within themselves, indeed within their communities. And I think there were certainly lots of intuitive and expected results there. But I suppose when people use the word loneliness, there is a kind of stereotypical view to shift towards an older person living alone, perhaps immobile, not connected with her community. And I think, as Gullis just mentioned there, even just last week, our local association in Kerry published a poll in relation to over 600 Leaving Cert students. And I think it was 46.9% cited loneliness being the biggest impact of COVID on their experience. So it certainly can be a subjective feeling. And I think it's also curious to see, again, not entirely surprising, to see the huge differential between people living alone and experiencing loneliness. And I suppose I've asked, in terms of the direction of causation there, how in our communities have so many people found themselves living alone? And I think probably over the last number of decades, we've been seduced into believing we can be entirely independent and self-sufficient, when really all of evolution suggests otherwise. So we're naturally incomplete, and we need other people for collaboration and validation and emotional regulation. And still we seem to have been driving towards this, being in our own space and being that in our home or in our car, but removing other people from us. So I think it's been fascinating in that regard. And also in terms of who would you call, almost that Ghostbusters question, in terms of if you're feeling lonely, who would you make contact with? And it's interesting, across the NGO sector in the mental health space here in the Republic in particular, certain agencies running helplines have found that the calls have become extended. They're longer calls. And they're longer for two reasons. One is that people are, I suppose, seeking additional help. And the other is that many of the signposting opportunities where you could refer people forward, many of these programs haven't been available for in-person contact. So I think it's been a really useful poll and some really important findings there.
Okay, thank you, Martin. Denise, do you have any reflections on what's been said, or the poll, or the data? Anything stood out for you that you want to comment on?
There are a couple of things. I suppose it mightn't be obvious to people immediately why someone from a volunteering organisation would have an interest in loneliness. And I always feel the need to kind of explain that it's a two-edged sword, because it's very clear that volunteers are making a difference to loneliness. So we have a volunteering project that does befriending. We've been doing that telephone befriending throughout the pandemic. It's been making a big difference to the lives of the people who are receiving the calls, and indeed to the people who are making the calls. And I think volunteering is it's that two-way thing. So the people who help have that positive benefit, as well as the people who are being helped. And I think that's why we as an organisation have really taken an interest in, certainly in Northern Ireland, in the work that's been going on around the policy around loneliness. And that's why we've been involved in it. So one of the things I suppose that did strike me from the data is the issue about the difference between rural and urban. And I suppose there is a narrative, a perception that, rural isolation is a really big challenge. obviously that can be the case for some people, but the data doesn't seem to show that. And it's interesting for me because volunteering is higher in rural areas than it is in urban areas. So actually there is something going on there about social connectivity and resilience that is in rural communities that perhaps isn't so prevalent in urban areas. I just think it's something that would be useful and interesting to explore a wee bit further. So that was just my reflection on it.
And Denise, your organisation, you led on the BBC campaign.
Yes, yeah. So we were fortunate enough. We applied, before the pandemic, actually, we applied to be the partner for the BBC campaign this year. And we were delighted in the end to work with the other groups that are partners in the policy group on loneliness in Northern Ireland to deliver that for the BBC coming up to Christmas. And that's really part of that public narrative, which is so important. I mean, you can see it as a facet in public policy around loneliness across the UK and in other jurisdictions as well, that actually it's important to create that space for people to say, yes, this is me. And somehow having that in the public narrative through the BBC, it does allow other people to say, actually, it's okay for me to talk about this because other people are talking about it. And I think one of the things I suppose I've thought as a slight positive in a hideous year is that actually we are talking about this now and everybody's talking about it. No group is saying, oh, that's them, not me. It's actually something that everybody at times has experienced over the last number of months, and it's given everybody permission to say, actually, I identify with that and we need to sort this out because it's not working. So I think, if there's one good thing that has come out of this pandemic experience, that has been definitely for me something very positive.
Thank you, Denise. Brian, do you have any thoughts or reflections on what's been said or the data or the polls? Anything stood out for you?
Well, I certainly would concur with the other panelists. I mean, I think COVID has been an extraordinary and horrible human experiment on what happens when you isolate humans and if you really severely restrict their social connections. And what we've seen is really the emergence of loneliness and isolation as a very serious issue from health and well-being of our population. And really, we see the significant impact that it's had on health and well-being across all age groups. I think just in terms of the data, I think what's happened, particularly in young people, adolescents, young people, young adults, I mean, that really kind of has hit the stereotype of loneliness, on the head. And that's really been very, very striking for me. And I think it means that there's an awful lot of work that we have to do in this area, because a lot of the focus has been on older people, and perhaps we've been neglecting the impact of loneliness and isolation on younger people, on their social development, and the development of the social brain. And I think that's probably something that we're probably going to get into in the discussion. The other thing that struck me about the data was people with pre-existing conditions. And of particular concern to me, and I'm sure to people like Martin, would be people with pre-existing mental health conditions. And the impact that loneliness and isolation has on the development of depression. It's a big risk factor for depression. So that's a big concern for me, not just right now, but also what's going to happen, with the tail of COVID and what's going to happen as we come out of this. Loneliness and isolation, but particularly loneliness, risk factor for depression, but also can increase hopelessness and despair in people. And again, what you've shown us with regard to young people, I think we have to be particularly mindful of that as we think and move towards, what are we going to do about this?
Okay.
So they're just my immediate thoughts. But I think also the impact of loneliness and isolation in these people with pre-existing conditions, yes, people with pre-existing conditions seem to be more likely to develop loneliness, but also I think loneliness can impact negatively on physical health conditions. And you mentioned frailty when you were in your talk. I think we know now that loneliness probably and isolation decreases physical activity, connection, but also has an impact on physical health, and people are more likely to decline and deteriorate from a physical point of view. And I think we've seen a lot of that during the lockdown.
Okay, Brian, thank you for that. Brian, I've heard you tell how you became interested in loneliness. Maybe you want to just briefly share your experience as a clinician working in this area, because it's really insightful.
well, this goes back a while, about 25 years ago. And I mean, I had a patient who was referred to me for treatment of depression, and she was a woman who had been bereaved maybe 6 to 9 months before that. And the diagnosis was depression from the general practitioner, and yes, she had depression, but I couldn't understand how the sort of interventions, the talking therapy, or even medication wasn't really working. But really, when we began to talk about it, the big problem was loneliness. It was an emotional loneliness. It was the lack of that confidence, not having somebody that they could trust, close to, that they could talk to, and it gave me pause to think about really what was going on here. And it was really until we tackled the issue of her emotional loneliness that there was a way forward in terms of the depression, and that was sort of my way into this. And I think, you know, you see this emotional loneliness now during times of COVID, and you've alluded to this in terms of the data you present. I mean, thinking about all these older people with dementia in nursing homes, where there's a lot of activity, a lot of people around, so they're not actually isolated, but they're missing that contact with the family member, the friend, that important emotional connection, and they're emotionally lonely, and that has a huge knock-on effect then on their physical health and on their mental health. And that's why, again, what you were saying is we need to really understand, you know, the loneliness, what it is, the dimensions, how it develops, the risk factors, how we can intervene, because no one size fits all as we try to tackle loneliness at a population level, but particularly at an individual level.
Thank you, Brian. Thanks for that. And thank you for sharing that story. One of the things, and it touched on the point that Kula said at the start, was on social media. And I'm really struck by the age group that had showed that the greatest increase in the level of are those that are most likely to use technology. So it tells us something about the nature of technology, that you may have, 1,000 friends. I was about to say Facebook, but my children tell me Facebook's only for people my age. But you may have 1,000 followers, but that isn't. It seems not the connection. Kula, before we get into the questions, do you any thoughts on that?
I think that's right. I think, and you call them, and we call them friends on Facebook, but they're not friends, are they? They're just people, you know, who read stuff that we write about us. And as I said, I think that we compare ourselves to people we see on social media, and young people do that a lot, and see other people having fun, and they're not having that same sort of fun. So particularly young people, when they take their reference from others and often try and see themselves how others see them, and they don't always like what they see, rather than that having that confidence and self-esteem. So I am really interested in talking about sort of that stigma, and what COVID has done around the stigma and reducing the stigma, but also the stigma of having a young person, a child who is rarely alone, as I've said, saying, I feel lonely, or I feel isolated. But social media is a wonderful thing, as we've learned during the pandemic, and it's a great thing for young people. But it can't be the only thing. It can't be the only way we engage with human beings. And that's what we spent up until March, the end of March last year. We spent all our time going, you need to do social media, but you need to work in the offline world as well. And now we've pushed them into social media, and that isolation has become exacerbated.
Okay, thank you. We're going to move now into some of the other questions. And one of the questions that came in was, what types of things do you think are helping people remain resilient during the pandemic? So I'm going to ask Martin to maybe reflect on that. What have you noted from your organization, from your experience, that are helping people? Because part of the day, it was striking, the questions that came in they were asking, what can we do? What will help? What will work? So this next section is some of the what works questions. So Martin, do you want to share some of those? What types of things do you think are helping individuals remain resilient during the pandemic?
And I think it's a really interesting point, and it kind of reflects some of the findings in the poll as well, in terms of, I suppose we've seen an interesting phenomenon of people who would naturally enjoy good mental health. And either by accident or design, they had baked into their lifestyle a whole series of things that kept them well. And that was either social connections, friendships, hobbies, sport, culture, you name it. And obviously, and unfortunately, we've had to use some fairly primitive tools in terms of social distancing as a way to keep people safe. And that has been our most effective tool in combating COVID, but it has lots of side effects. And we've had a lot of contact from people who are saying, I am a coper. They understand themselves as a person who enjoys good mental health, but something has radically changed. And I've described this probably more than once as almost like playing a game of social kerplunk, where you can remove some of the cocktail sticks and you can remove one or two of your coping strategies and you'd probably glide past. But also the fact that many of the friends you would wish to reach out to make contact with, because it's a universal experience, we're all traveling through this together, albeit at different paces. I think we've certainly noted a number of people who are saying, I was coping, I was fine, I was holding it together, I was being strong for my partner or for my kids or for my colleagues, and suddenly I hit a crunch point. So I think some of the things that we've noticed people have pivoted towards, and sometimes very successfully, definitely has been elements like outdoor exercise, getting out, being active, using some of the 5 ways to well-being around connectedness, continuing to learn, etc. And we've also noticed people moving away from consumerism to creativity. And that's investing in hobbies, in art, in music, and finding that you actually have an opportunity. I think certainly over the next number of weeks, if we now understand we've 6 to 8 weeks, the question is, what do you want to show for that? Are you just going to be locked up for 6 weeks? Or are you going to do that thing you always promised yourself but could never have an opportunity to do? And it might be learning a language or writing or re-engaging with a friendship or whatever that might be. So I think we've seen people being very creative and using lots of different technologies. Like we know, for example, that with young people, it's really important to have one good adult. And if you're very fortunate that one good adult is in your household, but they might equally be an aunt, an uncle, a sports coach, a teacher that you can relate to. So actively keep that connection alive. And we know from research, when Brian mentioned in terms of people with pre-existing mental health needs, a really good piece of research done in UCD called Enabling Recovery. And as people recover from significant mental health needs, I think we're beginning to understand it's not so much recovering from, but it's recovering for. So what is your life about? Is it enchanting? Is it bereft? Is it an empty space? Or do I need to rebuild relationships and form and find new meaning as well? So I think it's certainly, we've been quite excited in terms of the creativity, the innovation, and I suppose it's also about having a number of different arrows in your quiver, that there's no singular coping strategy you should depend upon. You should have an array of these, and whether that's in connection, it's about continuing to learn, staying active, and being a volunteer. One of the challenges for our organization is, again, sometimes the demographic of volunteers can be older people who had to cocoon at a certain moment. And we found that people who are naturally extrovert and naturally contribute to their community found it really difficult to be deprived of that opportunity. So that caring utility that allows so many people to form a sense of themselves and how they are within their community, if that's been blocked off, that's been quite difficult for many volunteers, and people are naturally engaged with their communities. So we've certainly seen some exciting and interesting ways, people using webinars, people using a whole range of different technologies. And so long as they acknowledge that, these are pay limitations, they're not the real thing, and we are still keen to revert when the opportunity arises.
Okay, thanks, Martin. I'm going to go on to Denise, but there's a comment that's come in, and I think it's the term resilience was part of the question submitted, but there's also the challenge when you use resilience that you're saying, well, you're not resilient enough, but we have to recognize that people use different terms in different ways, but it's really about what copes. So thanks, Martin. Denise, from your organization and your experience, I was going to say as a CEO, but also a volunteer, do you want to share what do you think what's working for people during the pandemic?
So we have seen a very mixed picture with volunteering during the pandemic. So there are some opportunities, as Martin's referred to, that have been paused pretty much. If you're doing, I don't know, youth work, perhaps, some of the sports groups, just haven't been able to fully operate since last March. And the people whose lives, you know, I mean, volunteering is an intrinsic part of lots of people's social life. And those people have really felt that loss. And I think there will be a big challenge in rebuilding that and building confidence back again to get people to come back to volunteering. And it's very hard to see that how that's going to land. But then there's also been another side of this as well, with new opportunities emerging. And we've definitely seen that even in some of our projects. We're supporting vaccination rollout at the moment. We're also doing the befriending telephone calls. We've seen new people coming into volunteering who wouldn't normally have had the capacity or the time or the interest. So there has been a transition. We've also seen over the spring months, particularly, a huge upsurge in kind of that narrative about giving time and helping and understanding about that. I think probably that has tailed off a wee bit over the last number of months, and you can certainly see that in the NISRA stats that you refer to, actually, Roger. There's other questions in that report about giving time, and you can see that drop off in the autumn and winter months. I suspect that's just a natural progression of how people's lives have been over the last little while. But the challenge, I think, for volunteer involving organisations now coming into the spring with things reopening is to try and create that pathway back for some of those face-to-face opportunities to help people to have the opportunity to build back. I am also struck by, just reflecting on what Brian and Kula were saying about young people. I mean, it's also partly about expectations. I mean, you said in your presentation it's to do with that subjective feeling, you know, and I reflect on my own family experience and feeling at that age they're expecting to be going out and meeting friends and, you know, seeing that social media life being played out, but in their own reality. And actually now at the moment they're not experiencing that, and they feel doubly cheated almost, that they're missing out on so much. And I do think that's part of what's playing out in terms of some of those statistics around younger people as well. No, I think it's important just to reflect that. I mean, I think the 5 ways to wellbeing was something I was going to talk about this morning as well, because volunteering is a great way of giving, but it's also a great way of keeping connected. And I was talking to somebody recently who was telling me that, you know, they were working from home and all the rest of it, and they were feeling a wee bit fed up. And one evening they decided they were going to make the effort to phone somebody else. And that informal, just giving that time to phone somebody who they knew lived alone. He said, I spoke to him for 2 hours. He said, but I think I came off the phone better than he did. So I just thought that was an interesting reflection, just on a personal level as well. And it doesn't always have to be formal with an organisation. You can do this just in the ordinary run of your life, you know.
That's brilliant. Thank you, Denise. And actually, the point you touched on about younger people, so many in that age group were expecting to go to university for a very different type of university experience. And that's clearly, you know, their expectation hasn't been met for many of them. Do you want to add anything to that, particularly from a children or young person's perspective?
I think just to say, you know, just to reiterate what others have said about, we've seen young people become quite creative and learn instruments and languages and baking and all sorts of things. So we've seen those issues about how young people have overcome. But it is. I just can't tell you how heartbreaking it is, and you all know this as well as I do, that the rites of passage that the young people missed out, and this isn't whinging, because we all know, and young people aren't whinging because or whining because they know people have had it much worse, particularly older people and people with underlying health conditions. We're not comparing; they're not comparing their experiences. But we were on a Zoom call with a group of young people, and one young person said, "There on the wardrobe is hanging my dress for the formal, and it was supposed to be tonight." Do you know all those things? You know, I was supposed to take my driving test. I'm 17. I was supposed to take my driving test. You know, leaving primary school to go to post-primary, that was done very, very, you know, social distance and remote. And then you have the big thing of going to university, and this is where social isolation and young people are very worried about having been de-skilled in social interactions and face-to-face interactions, particularly with new people. but this is what they should be. You know, there's a lot of them preparing. We were preparing last summer, and we'll start and starting to think about it this summer about going, and they're now really worried that they've got out of the way of engaging in new scenarios because they've not been in the public domain in that setting for so long, and they're really worried that they've become de-skilled and that socialized. So the pandemic has taken away so much from young people that we all took for granted when we were their age, or my own children. But I know that as a daughter, as a mother of a daughter who is at university in her second year, she's barely had any face-to-face teaching. She hasn't, and as a mum, I'm quite glad she hasn't been on those drunken nights out that students do. But it's a rite of passage to do those things safely. It teaches them so much. And so, yes, they're very, very worried about what they've lost in themselves and their ability to enjoy the university experiences. And again, I suspect we'll see quite a few deferring again this year. Because they want to have the proper experience. We'll see.
Thank you, Brian. I have a question related to this one, but it's a separate question, more specific probably for you. Do you have any recommendations for specific activities for people with dementia who've been maybe missing the normal interactions, you know, given things like video calls may not work as well for this group, specifically for that group of people? Anything from your experience that may help during loneliness during this pandemic?
I mean, it's a very good question, and it's a very difficult question to answer. I mean, and I would always take a very individualized approach. But for people who, with cognitive impairment, dementia, living on their own, what I always try to do is try to focus on you know, what's meaningful to them, what's a meaningful activity to them, or what gives them a sense of purpose. So that'll vary from person to person, but oftentimes, you know, consultation with family or with a healthcare professional, you can find areas of interest, areas that they feel are purposeful for them. And that could be around things like gardening, could be cooking. Also trying to find areas that have meaning for them. And for some people, it could be listening to the radio, it could be reading poetry, it could be reading books that they are familiar with. So it's really trying to sort of figure out with that individual what gives them a sense of meaning and purpose, and what is individualized to them. And generally speaking, you can work out and work through a menu of activities or interests to keep people occupied, keep people involved, and sort of have them at least connected into their lives and the lives of their families. But it's, you know, it's been a huge challenge, I would say, to people with dementia living on their own, but also for caregivers. And I think, again, in terms of special groups that have been affected, I think that people with dementia, whether they're in long-term care or whether they're living on their own, or living with caregivers, and the caregivers themselves. I mean, I think this has been a hugely stressful time. And I think there's been a lot of negative impacts for their health, physical health, and mental well-being, and also for the caregivers. And I think, you know, as we come out of this, you know, we really need to think very purposefully about how we're going to try to improve and increase the supports for these types of vulnerable populations and caregivers, and not just caregivers of people with dementia, but all caregivers, because these people have become quite lonely, quite disconnected because of lack of services, and because of the effect of the restrictions. And it has had huge impacts, and we really need to think carefully and purposefully about how we're going to try and improve the situation for them going forward.
Thank you, Brian. One of the things that I've learned in the area of loneliness is important. That loneliness is a very personal issue. It's a very personal experience. But it's also ensuring that you match the correct intervention with the requirement of that individual, rather than an off-the-shelf type of approach. It's understanding what is it that individual, whatever age they are, need, and ensuring you match need with supply, because the right intervention with the wrong person will just not work. And that's sometimes forgotten about. So we'll move back on. We have so many questions. Given the known association of loneliness with mental health, what plans do you think should be put in place after the pandemic? Martin, do you have any thoughts on that? And it's a bit like we have a question. I'll group these two questions together that have been submitted. A draft 10-year strategy for mental health is currently out for consultation in Northern Ireland. Do you think loneliness and social isolation needs to be a core aspect of this strategy? So I'll ask the two colleagues in Northern Ireland to answer that part of the question, and Martin and Brian to answer the more general question. So Martin, what's your thoughts on that?
I think we've learned a lot, I suppose, in terms of the how our whole society has shifted and maybe, as I say, been sleepwalking into a space that isn't necessarily sustainable for individuals. And we've seen some really interesting things. We're actually recruiting a staff member at the moment to lead out on a phenomenon called Thrive. Particularly, 70% of the world's population are living in cities, and that can be a really isolated place and an anomic place. I remember working with some colleagues when we were opening some group residential settings, and we wanted to see were people actually just moving to a new address, or were they genuinely engaged with their community. So we devised a tool to assess social integration, and we decided we'd try out the sensitivity of this tool on staff members, and had simple questions like, can you name your neighbour 3 doors down? Do 4 of your neighbours know your name? Are you known in a local shop? Are you a member of a local club? And interestingly, none of our staff passed the criteria. Wow. So we were trying to contrive this Walton Mountains type community, which exists on Hallmark cards, but the question is, does that exist in reality? So I think we can learn a lot from emerging economies as well. Very simple things like urban design, like buddy benches, park space, and because people will be more cautious around social distancing, creating a space where people can naturally move at their own pace. And I think it's really important point you just made, Roger, that this isn't a contrived, prescribed befriending, that something spontaneous happens every Tuesday evening at 7:30. That has an artificiality to it, and people see it through that. In fact, I've heard people use mental health service describing staff members as paid pals. And it doesn't feel naturalistic. It doesn't feel like it's tailored for their own particular needs. So I think how we design our communities, we recently had a call from a lady who was wondering how many minutes of mindfulness would she need to do each day to counteract the 2 hours spent on the M50. And the answer is, don't spend 2 hours on the M50, but that's not an economically rational position for her. But certainly where people socialize, whether that's in a bar or in a workplace or through a hobby or amateur dramatics, I think we need to be much more proactive, and that it's government policy to do this, not accidental. But I think we do need to be a little bit careful that we're not forcing a form of normalization that everybody should enjoy my level of socialization because it's good for me, it's good for you. So it's being respectful of that and having built environments and lifestyles and work shifts that allow people to engage with their community at a pace that they're comfortable with and in a dignified way, and also to retract from the community. We're actually doing the field work at the moment in terms of people who are at the opposite end of the spectrum, who are often young parents working from home and homeschooling, which is proven to be an overstimulation. So we need to rebalance this and to mobilize more people to be engaged so we can share the burden more effectively and allow people to feel more included. So I think there's lots of avenues we can explore there. And I think we're beginning to see the horizon of what's beyond COVID, and that's really encouraging.
Okay, well, that's great. Look, I just want to remind people, believe it or not, we have 5 minutes to the end. We could have booked a 2-hour slot for us to have this conversation because it's very rich. That we're covering so many areas. So just very quickly, Denise, do you have any comment with regard to that, a 10-year mental health strategy currently? Do you think loneliness and social isolation needs to be a core aspect of this strategy?
I certainly think the word loneliness needs to be used in the strategy, which it currently isn't at all. And I do think there's been a miss there. I don't know how come, but I think they need to revisit that because it's not there at all. And there clearly are links. I mean, it's not in itself a mental health condition, but at the same time, it's a trigger for lots of different other things. And I think it needs to be considered. So yes, and I think, I suppose just in the sort of final point in terms of wrapping that up, I mean, I think we are the only part, Northern Ireland is the only part of the UK that doesn't have a loneliness strategy at the moment. And I think we need, as a policy position from the executive, it would be fantastic to see some movement on that in the near future. So that would be something that we would be very keen to see.
Thank you, Denise. And you just opened another topic when we're trying to close. So thank you, it's brilliant. But Kuma, just one sentence with regards to the mental health strategy. I know that's a difficult. What's your thought on that before? And folks, I'm just going to tee you up. We're coming into the last, so it's really the message you want to get out at the very end back to people about what they should do. So Kuma, just in terms of the mental health.
I think when you look at causes of loneliness, if there are issues concerning someone's mental health and well-being that causes the loneliness and the social isolation, then of course it should be included in the mental health strategy. But I want to say one thing, we also have a children and young people strategy as well. So it's what I said at the beginning, is it should be a theme across, like communication and a number of other things that are barriers for young people. So it should certainly be included. And I'll keep my powder dry on a loneliness strategy.
Thank you very much. Okay, so there were so many parts of things we didn't cover, like technology and the digital divide. I could have shared some of the brilliant work Professor Jerry Levy's doing at Ulster University in the Banford Centre, which is an intergenerational approach. I live that with my mother in the terms of she can use technology, but only when we support her to do that. So there's so much to think about, carers. But could we just all have one sentence about your message or your final words of what people can do as individuals in a society to address loneliness or social isolation? Just Brian, just a sentence, any thoughts of what people, you've covered a lot, but just a final message for people?
It's a serious problem. It's a serious problem for health and well-being, and we need to act now. We need strategies, but actually we need to act now. I would focus in terms of secondary prevention, looking at risk groups and kind of, I think what we need is a lot of more training and awareness for healthcare professionals so that they can incorporate loneliness into a risk assessment. It's an important index of health-related well-being, and we need to know about it. It needs to be identified, detected, and then we need to develop more effective interventions.
Okay, thank you. Martin, have you got a line or a few words?
I think certainly it's mentioned here a number of times in terms of young people, the really important life tasks that many young people have had to postpone or even lose out on. And these are critical developmental goals, like every society has a rite of passage. And the reason is if we neglect those, they will come back to visit us later. And we've seen everything from radicalization and people becoming isolated and inward and losing out on life opportunities. I think we need to circle back so we don't just erase 2020 and 21 from young people's lives at a critical moment.
Okay. Denise, from your perspective?
Yeah, from my perspective, just as individuals, I think we can all do that giving. So we can look out for opportunities informally within our families and our friendship groups and our neighbours to just reach out and to say, can I give you a hand? Is there anything you need? Or just to be a good friend. And then I think as we begin to emerge from this, I think we should all just have a wee look and see how can we get involved in our local community life and not just to leave it to chance, but to take a purposeful decision that that's something we're going to do. So that would be my view, Roger.
Okay, and Kula, do you have any?
The joy of coming last is I agree with everything that's going on.
Okay.
So I don't have to repeat, but also just want to say the one thing, don't assume that because they're a child, they're not lonely or they're not isolated. Ask the question, ask how are you, particularly if you're a teacher and you're welcoming those children back, ask how are you and listen to the answer, and not just with your ears, but just see what's going on for that child. Don't make assumptions, because what this work and the surveys and the work has taught us is everyone and anyone can be lonely. And so let's actually find out from the individuals themselves.
Yes. So thank you, panelists. You've been brilliant. We've worked you really hard on the questions. We had so many more questions to go through. So I really appreciate your time on that. I want to thank the Minister, Professor O'Neill, our Chief Executive, the ICT team who work behind, who makes this all seem very easy and straightforward. They've been working very hard to ensure this all goes so well. Leah, who looked after the administration, Aideen and Annette, who worked with me on the presentation. Thank you very much. Martin and comms. So thank you, everybody. Thank you. It's amazing the level of people who stayed with this to the very end. But here's my final message. I'm really struck by John Cacioppo, who said, as humans, there's a need to connect. We should think that loneliness and feeling lonely is like hunger, thirst, and pain. When you feel it, it's your body telling you you need to take action. So if you feel it, please take action. Thank you very much, everybody. Stay safe. Good night.